Hello, this is Dr. Atwa. I'd like to share with you the aesthetic revolution that's going on right now. Our webinar tonight is about INMODE's skin tightening event. So I'd like to thank you for joining us for this webinar and this presentation. It's going to offer insights into achieving youthful skin without extensive surgery. Would you stay engaged, take some notes, and stick around until the end. So the purpose of this webinar is to show you and discover a non-surgical approach to aging and body contouring. It causes skin tightening. It helps you learn how to tighten loose skin and reduce wrinkles effectively. It also helps with body contouring to explore methods of how you can contour your body without excessive or extensive downtime. So who is this for? Ideal candidates for this procedure are for patients who want to reverse aging signs, patients that diet and exercise, but they still have some stubborn fat that they cannot get rid of. It's also used for patients that have acne scars or active acne or any texture concerns on their face or other parts of their body. With this procedure, you're able to achieve a youthful, natural-looking result without surgery. It's not suitable for those that expect instant results or for patients that have unrealistic expectations. Also, it's not for patients that do not follow our guidelines for pre- and post-operative care. What you'll learn today is the treatment mechanics of the Morpheus 8, Face Tight, and Body Tight, which are 3 different procedures that we perform in the office. You'll also see the benefits and the results with the expected outcomes from these treatments, and you'll see several real patient experiences with their success stories, how to get started, and how to go through the treatment process. Does this sound like you? Do you have loose skin? This is very common. We see that with patients after they've had weight loss surgery or take weight loss medications. Some people describe it as the Ozempic face, and they're struggling with this loose and sagging skin that they can't seem to treat. Also, patients that have stubborn fat, though, even though they're eating healthy, they're exercising, and they still have some fat that's really resistant to these maneuvers. And it's also for patients that don't want surgery. They're looking for a non-surgical solution for their problem. So there's a paradigm shift right now of non-surgical treatments. For skin tightening, you achieve a tighter skin with minimal downtime. For body contouring, you want to shape your body without large scars or hospital admissions. And you want a procedure to help stimulate the collagen production. That's what tightens the skin, and it's a natural process that has long-lasting results. So who am I? I've had over 2 decades of mastering surgical and non-surgical techniques for treatment. Leadership, I'm the Director-in-Chief of Surgery at St. Charles and St. Catherine Hospital in Long Island, New York, as well as the Chief of Surgery at Mather Hospital in Port Jefferson, New York. My expertise, I have performed over 12,000 surgeries and have assisted 7,000 other operations with other surgeons. When I started doing bariatric surgery about 8 years ago, a lot of the patients were complaining or were asking, what do we do with our loose skin afterwards? And I told them there was several options, and I've discovered the Morpheus Body Tight and Face Tight to help with the loose skin. So what's the opportunity and why now? There is a growing demand. There's increasing interest for non-surgical procedures. You have the 2 extremes for options for skin tightening. The lowest end is creams, where people will apply expensive creams and they don't really get great results. And the other extreme is with plastic surgery. You have large scars that costs a lot of money and may cause pain and has a long recovery time. So with the INMODE's Morpheus and Body Tight and Face Tight, they've covered this gap where you have excellent results with minimal downtime. So you'll see natural results. Patients are seeking now subtle, natural-looking improvements in the way they look and feel. And there's minimal downtime. It's a quick recovery, and it appeals to people that are too busy, that can't take several weeks off and don't want to feel the extensive pain with plastic surgery. So the advantage of these treatments, the first one is skin tightening. It improves the skin texture and firmness, and you can see from this picture, it stimulates the collagen, the natural collagen that your body makes. So with the treatment, the body senses there's something going on, and then it sends collagen to help heal that area, and that's what tightens up the skin and helps promote long-term skin health. Minimal downtime for a day or 2 with minimal swelling and redness, and it's perfect for people who have busy lifestyles. And it's versatile. It helps also patients that have active acne or acne scars, wrinkles, and hyperhidrosis, where some patients will have excessive sweating, and this will be a nice option compared to Botox injections. So how these treatments work, with the Morpheus 8, you're combining microneedling and radiofrequency to penetrate deep into the skin layers. And it helps stimulate the collagen production and helps improve the elasticity of the skin. With the Face Tight and Body Tight, it also uses the radiofrequency technique and technology to help lipolysis, which basically means to melt the fat, and also helps to tighten the skin at the same time. You're obtaining near-surgical results without the large scars. And we'll also add to these procedures liposuction that helps improve the results. So this is a graphic and shows how it works. This is the handle for the device, and tiny little needles come out from this device. These needles go through the skin and into the fat. You don't feel anything because we give some numbing medication, and it goes through. And when it goes through, these are gold tip needles. The tip of it generates the radio frequency energy. This is the positive end of the needle, and the energy goes from the positive end to the negative end. So what it does is it causes heat and coagulation and melting of the fat at the tip of the needle. And the rest stimulates the collagen to come in and to stretch out the skin. It's basically shrink wrapping for the loose skin. So the use of the Morpheus, it's used on the face and neck, for the arms when you have loose skin, for the abdomen and the flanks for people that have lost a lot of weight, or after a delivery. People talk about a mommy makeover, or for even men that work out a lot but they still have some fat that they can't get rid of. Also, it's used for patients that have active acne or acne scars, as well as the hyperhidrosis, which is the excessive sweating. This is a real-time example. This is my sister. She's 4 years younger than me. And when I asked her what she wanted for her birthday, she said that she wanted a Morpheus treatment. She's lost some weight, and she had some loose skin underneath her chin and her neck, as well as underneath her arm. So she wanted both areas treated. So she came over. We did it in the office, and you can see the results right away. This is for her arm. You see how it's a little red and swollen. And this is for her face. And she was very happy with the results. This is another patient that had the face tight. And this is an animation to show you how the face tight works.
Body contouring is one of the most popular aesthetic procedures in cosmetic medicine. The optimal solution requires a minimally traumatic local reduction of adipose tissue, combined with significant skin contraction. The body tight contouring procedure uses radiofrequency energy for internal fat lipolysis and external collagen contraction. RF energy flows from the internal cannula toward the external electrode placed on the skin's surface. RF power is regulated based upon online measurements of skin temperature and tissue impedance. The heat generated around the cannula tip coagulates blood vessels and liquefies fat to reduce post-operative pain, bruising, and edema. Uniform RF thermal exposure aids, smooths, and evens contour results. Thermal contraction of fibrous septae and dermal collagen results in immediate body contouring, which continues to improve over the next 6 months.
So these are some of the results. This patient that had the loose skin and fat in the lower abdomen, and this is after she had the body tight procedure. You can see this is another patient that also had similar and great results. And these are with tiny little needle sticks in the abdomen. There's no scar, very minimal downtime, and you're back to yourself within a few days. So what are the common concerns that patients ask? Number one is pain. So there's very minimal discomfort. For the Morpheus, we put the numbing medication on the skin of the face and the abdomen of the arms, and it stays on for about 45 minutes, and you're numb after that. We also add Pronox, which helps you feel comfortable during the procedure. For the body tight and face tight, we add lidocaine, which is a numbing medication, as well as certain pain medication. But all the procedures are done while you're awake in the office. Downtime, 1 to 3 days of minimal swelling and redness, and you should be back to yourself within 5 to 7 days. Is it right for me? If you have mild to moderate skin laxity, this is a perfect treatment for you. The other patients that I do not recommend this procedure, if you have a very large pannus with a lot of weight loss, then you might be better served getting plastic surgery for a tummy tuck, or if the insurance covers the procedure, that would be a better option. So it's a very simple 5-step process. You come into the office for a consultation and assessment. We decide on what's the best treatment option for you. We give you the pre-treatment plan, and we do this in the office. For the Morpheus, it's about a 45-minute procedure. For the face tight and body tight, it's about an hour and a half, and you go home the same day. And afterwards, we give you some lotions and creams to put on the area to hydrate the skin. So in order to optimize the results, there's certain things that we have to do before the procedure. The first one is to quit smoking so it doesn't decrease the healing. And also we try, if patients are overweight, we have them lose weight beforehand. And the ideal patient is somebody that has a BMI less than 30. So there are several options for weight loss. So you can try some protein shakes where you can take them for a few weeks or even a few months to drop your weight. You can try medical weight loss. Dr. Barshi does the injection and the pills. You can lose with this about 10 to 20% of your weight. We also do the gastric balloon, where we put a balloon inside the stomach endoscopically, and you lose about 30 to 50 pounds. It stays in the stomach for about 6 months, and then we take it out after that with the endoscope. So it's a very minimal procedure. The best and long-term results for weight loss is with bariatric surgery if your BMI is above 30 or 30, if above 30 with a medical problem or above 35. And with this, it's a simple procedure. It takes about half an hour, and you lose about 30% of your weight. And that's how you get the best results. So these are some of my patients that have had a weight loss surgery, and they did great after the procedure. This is another patient. A lot of patients that really work for me. So you have this patient that no matter how much you exercise or lose weight, it's not going to tighten up the loose skin. So with the Morpheus, very simple procedure. It tightens up the skin, and they get great results. So what you need to succeed is a proven treatment system, which we have with the INMODE. It's the best radiofrequency ablation and treatment system out of all the other systems that are on the market right now. You need somebody that has experience, a qualified expert, which is myself, and we develop a personalized treatment plan for what your needs are. So we have a special offer for the next few days. If you reach out to our office, we have a great discount. You'll get about 20% off, or basically if you pay for 2 treatments, the 3rd treatment will be for free. So these are some of the prices. For the most common is the medium and large area. The medium is for the face and neck. It's originally at $3,750. We're taking $750 off, so it's about $3,000. For the large area, we're taking $800 off. Normally it's around $4,000. It's offered right now for the next few days for $3,200. For the body tight and face tight, for the scarless facelift, it's about normally it's $5,000, but we're offering it for $4,000, so it's $1,000 off. The same for the arm. For the full abdomen, it's $1,200 off, so it's about $4,800. And those are the other prices for the thighs and the flanks. So if you have any questions, please reach out to our office. You can call us at 631-476-9296 and give us a call and set up a free consultation. We can come in and evaluate what your needs are. Thank you.